Hey everybody, I'm back. It's day 2 at ISID and it's been a jam-packed day already. We're about halfway through. I'm so excited to be joined by Dr. Nicole Ward. She is the Vice Chair of Research of the Research Department in Dermatology and Professor of Dermatology and Professor of Pathology, Microbiology, and Immunology at Vanderbilt University. And she just chaired a panel, the UCB panel on hidradenitis suppurativa. It was a great panel, chock full of lots of information, and some key highlights were HS is much more complicated than psoriasis, and we need more translational work done to make a difference. So, Dr. Ward, why don't you give us your highlights? What were the big takeaways of this talk?
Okay, so you already sort of said the two major ones, that it's very complicated. We still don't have a really good understanding of even the genetics of the disease. It seems like there's sort of two pathways of pathogenicity. One of them is probably more cytokine driven because there's some success using anti-cytokine therapies like TNF-alpha antibodies, 17A inhibition. But what's remarkable too is that the IL-23 inhibitors aren't working.
Right.
But the IL-17 inhibitors do. So this is really
Very
interesting and suggests that different cell types are involved in HS than in psoriasis, although they all converge on this IL-17 pathway. One of the things Jim Kruger said repeatedly is that this is a very different disease, and we don't understand it, and there's great heterogeneity.
Yes.
So we saw that even in different geographic regions of the world, it affects people differently. So I think in North America, it affects women more than men.
Right.
But in Asia, it actually affects men more than women.
Yeah.
And we saw a case study today presented of a 13-year-old girl. And her primary complaint was pain and appearance. These are big issues for young girls, young people.
The disease has such a tremendous psychosocial impact, which, like many dermatological diseases, we're treating the disease itself and then also the mental health of the children that these diseases are affecting, which makes it even more difficult. So with this disease being such a challenge, what does that mean for research, and what are our next big steps here?
Oh my God. Okay, so tons of work to be done. I mean, if we think about most of the work that's been done in HS has been done in adults, right? It's hard to do research on children, and children aren't young adults,
right?
As Dr. Sarah Winley always says, these are not just little people.
Not tiny
they're
humans.
Not tiny. They're not tiny adults. They're not tiny grown-ups. They're children. So that is one area that I think we need to work on. There are still need for translational studies. We need more clinical trials. We need more standardized outcome measures. At what line are we going to say a drug works versus it doesn't work? 50% improvement, 75% improvement. What if we find a drug that works? Can we identify ways to sustain the disease remission? Is there a potential cure? I mean,
That's the big question.
Yeah, and if you think about atopic dermatitis, psoriasis, and HS, we've spent decades studying psoriasis and have a really good understanding of it. We're becoming way more knowledgeable about atopic dermatitis and biologics, and now HS is coming right behind. And so I think it's just a matter of time. But yeah, we need more research about pathogenic mechanisms of disease. We need more translational studies done looking at targeted drug efficacy treatment strategies. And then, of course, we need to really understand how HS is different in adults versus children.
Absolutely. Now, all of that said, you are in the lab, you are a researcher.
Yeah.
So how can our clinician investigators help this research and help get it going?
Yep. So as a non-MD who does derm research and does translational dermatology research, I can't do what I do without having a clinical collaborator. So I look to my clinical collaborators for their clinical expertise. They are the ones that see the patients. They are the ones that know the nuances of the disease. They know the primary patient complaint. They know the primary parent concerns. And what I need is for them to talk about what they see with me and come up with ideas that we can bring back to the lab and we can test. So we can do it in, individual cells. We can take the pus from a draining lesion and we can study that in the research lab and try and figure out why things happen the way they do. And then I need my clinical colleagues because I go back to them with my findings, and they really bring it back to the patient.
So it's really this circular effort.
Yeah.
One can't do anything without the other.
And
so
it's a team thing.
Absolutely.
And it's fun.
Yeah.
And the bottom line is improve patient care.
Well, absolutely. And you get those little mini breakthroughs. I mean, this is happening all the time. I've talked to Dr. John Harris about those breakthroughs he has in his vitiligo lab, you know, and I think that's what really helps fuel our clinicians too, like seeing those mini breakthroughs coming out of the lab, but then also being able to put those breakthroughs back into the lab from the clinic side.
And one of the things that's exciting about this meeting that we're at right now is that you've got the global population of the best skin scientists in the world all together. And our ideas are bouncing off of each other, and we're building new collaborations, and we're talking about interesting data that we haven't yet published. And there's this energy that you can feel in the conference center.
It is. It's amazing. Everybody's getting a chance to, it's like one big think tank. And
It is.
Everybody's just bouncing off ideas, and there's so much energy. Well, thank you so much,
You're
Dr.
welcome.
Ward,
Oh my
for
God,
joining
it's
me.
my pleasure. I'll do anything for Petra.
Be sure that you keep an eye on conference announcements about Petra, because Dr. Ward will be joining us as a speaker. We can't wait to have her. We appreciate all the work you're doing and all the support you give our clinicians. Thank you so much.
You're welcome. Have a great rest of your meeting.
Thank you. You too. Hey, everyone. We're back, still on day 2. We are just a couple of hours away from the poster session, and I am joined by the lovely Dr. Roni Francois. He's a Pedra member, but you probably know him from his work at UCSF.
Just a quick voiceover here to reintroduce Dr. Roni Francois with his correct title. He is a clinical instructor and a second-year DermPath Fellow.
So give us your highlights of the meeting so far. What have you learned? What have you enjoyed?
I liked the IL-31 pathway talks. So obviously we have a new inhibitor that's not quite FDA approved, but seems very promising for pruritic disorders such as prurigo nodularis, and it sounds like there's some investigation into other pruritic disorders like atopic dermatitis. So that's one area that I'm following. But a lot of the inflammatory research has been very exciting with utilizing different tools such as RNA-seq and spatial transcriptomics.
Yeah, we've been hearing a lot about that in this meeting.
Yeah. It's exciting.
I know you're going to be giving a talk, so give us a little preview.
Yes, so I'll be giving a talk. My research focuses on NRAS mutant melanoma. So I'll be discussing how targeting SHOC2 in NRAS mutant melanoma cells is a promising therapeutic strategy. So
excellent.
Stay tuned.
Yes, and go ahead and tell everybody when your talk is going to be.
My talk is on Saturday, so it is the concurrent mini symposium 17.
Perfect.
And I'm the second to last talk, which is about 20 minutes before the closing ceremony. So,
all right, well, everybody better stick around for this guy. I promise it'll be worth it. Thank you so much for joining me, Dr. Francois. Enjoy the rest of the meeting.
Will do. Thanks, Jen.
I am here with the outgoing president of the Society for Investigative Dermatology and the Carolyn Walsh Slayman Professor of Genetics at Yale University, Valentina Greco. Excuse me, Dr. Valentina Greco. Thank you so much for talking with me today. I've been in sessions yesterday and today. It's been a really energizing meeting. And I just wanted to ask you, why now for an international coming together? What was the impetus for bringing all of us here?
Absolutely. So first of all, there has been a long tradition of coming together internationally between the American ISID, the Japanese, and the European one. And it goes far into several decades. But what they have realized over time is that there is a better model, first of all, to become global. So Taiwanese society, Australasians, Korean can now come and join in being a footprint that is much larger. And additionally, the previous model wasn't as supportive as it could be for all society at once when the international conference was happening. There's a new model that not only supports all societies as they come together, but creates also a continuity within each society with the capacity to sustain themselves through this partnership.
This is wonderful. And it is so great to see all the nationalities represented, all the different groups here. And like I said earlier, the energy has just been really amazing. I see a lot of collaborations happening. So give me your highlights of what you've experienced with the meeting so far.
first of all, it's a thrill to be in Japan and
Oh.
in Tokyo. And the opening ceremony where we heard
incredible.
the drum, it was just
Yes.
you could feel in your body, and I think it was mirroring the excitement that you're
I
describing.
agree.
Second, as you may know, each society has also their board meetings and as well as capacity to tailor not only to their own society but also across society. So being here all together is not only reinforcing the collaborations and the acquaintances that we can do within each one, but also bridging beyond. And so for me, it's been thrilling to go through the hallways for the posters or talks and talks that are often representing like the special guest lectures across all the different countries. So it's been just wonderful.
It really has. And what's next for you? I know you're the outgoing president of SID. Any plans to head up another organization, or what's next?
I've had often in my career a couple of homes. So the other one is the stem cell research. So I'm actually the incoming president there.
Oh, fantastic.
So I've been driving efforts in parallel in that society. There is an organization about the annual conference that actually is a preview of the president. So I'm already knee deep into that.
Yes, you are.
So yeah.
Well, we so appreciate the amazing work you did in your time as president with the SID. Pedra is grateful to have this partnership. And thank you so much for stopping by and visiting with me today.
Thank you so much.
Hello, everybody. I'm back. We're just nearing the end of day 2. We're about to head to the poster session, but I am lucky enough to be joined by Dr. Victoria Worth. She's professor of dermatology at the University of Pennsylvania. Thank you so much for stopping by to say hello, Dr. Worth.
Yes, it's great to be here.
It is, this whole meeting has been full of energy. There's a lot of excitement, a lot of research collaboration happening. I wondered, how are your feelings about the meeting so far?
Very much enjoying it. We started out actually with a satellite meeting of the international ICCLE, which is an international lupus and dermato group, and we then that has led into the ISID, which has been really wonderful. I love the focus on trying to do some translational research, trying to understand more about disease and some of the improvements that we're learning in terms of potential therapeutics. So I think that this has been is a really interesting time, and I think the ISID is embracing an approach to improving care for our patients.
I couldn't agree more. It seems very driven toward patient care, and there were so many great talks I attended this morning, some genetic talks on EB, some more talks on HS. Has there been a talk that has stood out for you thus far?
Well, I've enjoyed the innate immunity talks. We had a nice session this morning on dermatomyositis, where we were hearing about antibodies that might be associated with getting cancer, but also not getting cancer in dermatomyositis. And we also talked about the role of interferon beta in dermato. So there's really been a nice focus that way, and I've enjoyed those talks. I've enjoyed the plenary sessions. So it's been a really exciting meeting so far, and we're about to have our poster session.
Yay! So offline we were talking, you said you've been able to bump into a few of your past students. I wondered, how is it going? Is it a bit of a reunion here for you?
Absolutely. I have a number of postdocs who've been from either South Korea or from Japan. We've been able to really meet up and talk, compare notes, and see how well they're doing. Also students who've now become residents in the States, and it's been really great to catch up with them and learn more about where things are going for them. So it's been a really great meeting.
That's wonderful. Thank you again for stopping by. I will let you get to the poster session. We have a whole bunch more great science ahead of us.
Great.
Enjoy the rest of your meeting. Thank you.